Anticoagulation Therapy with DOACs, an educational initiative by St James's Hospital in conjunction with Bayer. You may have heard anticoagulants called by many different names, such as anticoagulants, NOACs, which stands for non-vitamin K antagonist oral anticoagulants, DOACs, or direct oral anticoagulants, or simply blood thinners. These terms have similar meanings. In this video, we will use the term DOACs to refer to these medicines. While you're taking your DOAC, you will be under the care of a medical team made up of hospital doctors, nurses, pharmacists, your GP, and other healthcare professionals. There are 4 different DOACs which may be prescribed by your medical team. These are Rivaroxaban, also known by the brand name Xarelto, Apixaban or Eliquis, Dabigatran or Pradaxa, and Edoxaban or Lixiana. You may have heard of a blood thinner called aspirin. Aspirin is not a DOAC. Aspirin is an antiplatelet. Antiplatelets, such as aspirin and clopidogrel, also known as Plavix, are also sometimes referred to as blood thinners. However, they are not DOACs. Antiplatelets and DOACs both slow the blood clotting process, but they do it in different ways. Antiplatelets make a type of blood cell called platelets less sticky. This stops them from clumping together and forming clots. DOACs slow the activity of clotting factors. Clotting factors are proteins which are needed for blood clots to form. Because they work differently, antiplatelets and DOACs are used to treat different conditions. So what are DOACs used for? They are used for conditions such as atrial fibrillation, also known as an irregular heartbeat, deep vein thrombosis, also known as DVT or a blood clot, and pulmonary embolism, also known as PE or a clot in the lungs. DOACs are used to treat blood clots and to prevent conditions including stroke and recurrent clots. You might be concerned about side effects associated with DOACs. All medicines have side effects, and not everyone will experience them. The most common side effect with DOACs is bleeding because they slow the blood clotting process. Signs of prolonged, excessive, or unusual bleeding might include nosebleeds lasting longer than 10 minutes, blood when you go to the toilet, blood in vomit or in spit, unusual headache, heavy or unusual bleeding during periods or other vaginal bleeding, prolonged bleeding from cuts, or unexplained bruising. What should you do if you experience a side effect? If you have severe bleeding or are unable to stop a bleed, or if you're involved in a major accident or suffer head trauma, you should attend the nearest emergency department. If you experience minor bleeding or other side effects, you should inform your medical team. You should never stop taking your DOAC without first speaking to your medical team. What will happen if you need to go for surgery? You should always tell your doctor or dentist that you're taking a DOAC when surgery, a procedure, or a biopsy is being planned, and again before the actual surgical procedure. They might decide to stop your treatment for a short time. It is also important to tell your doctor and pharmacist that you're taking a DOAC before you start any new medicines. This includes any medicine that your doctor prescribes for you, any medicine that you buy over the counter or in supermarkets, and any herbal or homeopathic medicines. Examples of drugs which can interfere with DOACs include some antibiotics, certain antifungals, certain cardiac medicines, and some medicines used to treat epilepsy. You should also be aware of other medicines which, like DOACs, can increase your risk of bleeding. Examples include a type of antidepressant known as SSRIs, other anticoagulants like Inohep and Clexane, antiplatelets like aspirin and clopidogrel, and non-steroid anti-inflammatory drugs or NSAIDs like ibuprofen, which is also known as Nurofen, or Diphen. You should speak with your medical team before taking these medicines. You might think that taking a DOAC means that you will have to change your lifestyle. There's no reason why you can't keep cooking, gardening, being active, and generally carrying on life as normal. Just remember to take extra care to avoid cuts and bruises. For example, being careful when using power tools or ladders, using protective equipment when playing contact sports, and avoiding high-risk activities. If you're not sure about whether or not you should take part in an activity, you should discuss it with your medical team. It's also important to eat a well-balanced diet, drink plenty of water, and limit alcohol intake. For some conditions, your medical team might advise you to reduce your caffeine intake. But you don't need to restrict your diet. Remember that smoking is hazardous to your health and can increase your risk of developing a blood clot. Your medical team can give you support if you want to quit smoking. You might be wondering if you'll need to have tests done while you're taking your DOAC. Your medical team will bring you in for regular reviews. At least once a year, your medical team will check your kidney function, your liver function, and for signs and symptoms of clots or bleeding. Your medical team may test more frequently if you're having issues with your kidneys or if you are at risk of developing kidney or liver disease. You might wonder if you can have a baby while you're taking DOACs. You should not get pregnant while taking a DOAC. It's important to use appropriate contraception throughout your treatment. If you do get pregnant, or if you're thinking of getting pregnant, do not stop taking your DOAC. Inform your medical team as soon as possible to discuss your treatment options. How long will you need to take your DOAC for? Your medical team will decide how long you need to take your DOAC for. This will be different for different conditions. For some conditions, DOAC treatment will be lifelong. When should you take your DOAC? That depends on which DOAC you are taking. Apixaban and Dabigatran are taken twice daily, exactly 12 hours apart, for example at 8 a.m. and 8 p.m. Edoxaban is taken once daily, either in the morning or in the evening. Depending on the condition you are taking it for, Rivaroxaban is sometimes taken once daily, either in the morning or in the evening, and sometimes taken twice daily. Rivaroxaban should be taken with food. You should not stop taking your DOAC without talking to your medical team, as you may be at risk of suffering from a stroke or blood clot. Do you know what DOAC you are taking and how to take it? Make sure to check these details with your medical team because it's important that you know how to take your DOAC correctly. What should you do if you take too many tablets? If you think you've taken too much of your DOAC, you should contact your medical team immediately because you may be at an increased risk of bleeding. What if you forget to take a dose? If you miss a dose, you might not be protected against blood clot and stroke. If you think you might forget to take your DOAC at the right time, set an alarm or ask a friend or relative to remind you. It's also important not to leave your DOAc behind when you go travelling or on holiday. If you do miss a dose, you should consult the patient information leaflet or contact your medical team for advice. But what is a patient information leaflet? A patient information leaflet is a document included in the box your DOAc comes in. It contains guidance on a number of topics covered in this video, including what a DOAc is and what it is used for, what you need to know before you take your DOAc, how to take your DOAc, possible side effects, what to do if you forget a dose. Your medical team will also give you a patient alert card. The patient alert card contains important information on how to take your DOAc and what to do if you experience side effects. It also has space for your medical information and your next of kin, and who to call in case of emergency. You should keep this card with you at all times and present it to your doctor, dentist, or pharmacist to let them know that you are taking a DOAc. If you have any questions about DOAcs, please contact your medical team.